another edition of Health Talk with Dr. Arya. Today is a continuation of where we stopped from last time, dealing with the red flags of cancer. Why is it important that we actually talk about cancer? Well, because it is the second most common cause of death, apart from heart disease. The good news is that a large proportion of cancers can actually be cured if we pick them up early. Unfortunately, most people present very late, and late diagnosis reduces the chances of cure. So hence today we are revisiting that topic and dealing with the other symptoms that we should know about. So the first symptom that we're going to talk about today is what we call unexplained anemia. This is when you have a low blood count. So you have fewer than expected number of red blood cells in your blood. This should always be investigated. Having anemia could be because you're not getting enough iron actually in your diet, and that might be sort of a non-serious cause for it. So if you're iron deficient, you might present as someone feeling tired all the time. But as you can see, feeling tired all the time is such a non-specific symptom because most of us can feel tired for many reasons. Either we are not having enough sleep, we're overworking ourselves, and we're not looking after ourselves. So that could be sort of non-serious problems. Even sometimes when people are depressed, feeling tired could present as that. People that have diabetes, initially some of their symptoms might present as feeling tired. So it doesn't always mean that you have cancer. Blood loss might be a major reason why someone might be anemic. And obviously if someone is losing blood in whatever form or shape, it is important that we investigate that, because actually it could be because of a tumor that is causing someone to lose blood. So if you have a blood test and your doctor tells you that you are anemic, often they might suggest that we investigate it further. If it's just a simple case of iron deficiency, then they could give you some supplements to boost you up. But often they might say, we couldn't explain it. We can't see any reason why this is the case. So we need to investigate it. And part of the test might be doing a camera test, either from upper to look at the upper part of your bowels, or having a camera test from the back passage to investigate, because usually that's the common ways that women lose blood. So that's unexplained anemia. That's a symptom for you to be aware of. But this also stresses why it is important to have routine checks. Because if you are the kind of person that often have a blood test, maybe once every year, then we could always see a pattern to see whether this is something new or this is chronic for you, okay? So the next symptom to be aware of is to do with the skin, okay? So we're talking about moles on the skin. This may appear as dark areas on the skin or raised areas. They might be flat even on the skin as well. Now, most people, if they've had a mole on the skin, they would say, I've had it for many years, it stayed the same, it's never changed. So when it comes to things on the skin, what you need to be aware of, is it something that is growing rapidly? So we're talking about days and over a period of weeks. It's just changed all of a sudden quite rapidly. It's becoming bigger and bigger, okay? Is it something that has changed in color? So most moles will be evenly pigmented, i.e. if it's pink, it will be pink, all around, throughout. If it's very dark, it's dark all around, okay? It's the same color when you look at any part of it. Whereas if something is more likely to be sinister, it will start changing color. So you will have like red bits here, you have dark bits here, all of a sudden it changes color, okay? So if you notice a change in color, if you notice some irregularity to it, so most benign or most sort of non-sinister lumps or moles tend to be, they look the same size. It's sort of when you look around it, it's round or oval, nicely sort of regular edges, okay? So if you have a mole that all of a sudden is just sort of becomes zigzag, changes in terms of shape, and it becomes very irregular, it's a bit disorderly in a way, yeah? Then you need to get it checked as well. Also, moles don't bleed. They shouldn't be bleeding. I know sometimes if you have moles in very awkward places, so maybe around the neck or in your groin or in other places, they may catch on your back. Women, for example, when they're putting on the bra, it might just get caught in it. So because of that, you may irritate it, but not. If that doesn't happen, okay, you can't explain it, and then this mole start bleeding, okay, it's a worrying sign, and you should get it checked. Yeah, has the mole become painful? Yeah, mole shouldn't be painful. All right. So if it becomes painful, so we're talking about something that has always been the same, and then all of a sudden it starts changing. Okay, then please do see a doctor to get it checked. I always advise that it's good usually to take a picture of your mole if you notice it for the first time, okay, and then keep an eye on it. And then maybe every month or every 2 months, just have a look whether it's changing anyway, okay? That way you'll be able to pick up a pattern. And if you're worried at all, please do see the doctor anyway. The next symptom that we're looking at is unusual vaginal bleeding or discharge, okay? And actually, when it comes to women, the kind of bleeding that we should be worried about most is what we call postmenopausal bleeding. So women at a certain age, they will go through the menopause where their periods stop, and this is because of withdrawal of certain hormones that regulates their period, that sort of stops, and that's why their periods stop as well. So for any woman who has experienced menopause, i.e. your periods have stopped for a whole year, okay? You've not had a bleeding at all for a whole year, and then all of a sudden, okay, you start bleeding vaginally. You need to see a doctor urgently, because we need to exclude cancer, okay? The first thing that we need to exclude is that this is not cancer that is affecting the lining of the womb, all right? Because naturally when women stop bleeding, the lining of the womb, you know, you're not shedding that, it's not there anymore. The lining of your womb becomes very thin, okay? So there shouldn't be any bleeding. So if any bleeding happens, then we need to find out where that is coming from. The other bleeding that women might get is bleeding on sexual intercourse. This shouldn't happen normally, okay? But if someone is bleeding on sexual intercourse, it could be due to many reasons. Is it coming from some irritation in the vaginal wall itself? Is it coming from the neck of the womb, which is the cervix? And is it coming from the womb itself, okay? So we need to then investigate. So often it's good to see your doctor, particularly if it happens, you know, once or twice or multiple times, and you can't explain why. You need to go and see a doctor to at least examine you and to make sure that it's nothing to worry about. And this is why also it is important for women to attend their cervical screening when they receive their letters to go, because part of that is trying to make sure that we pick up people that are at risk of changes in the cervix or the neck of the womb, and the likelihood of that changing into cancer, so that it can be dealt with quite early on, okay? Also, the other type of bleeding that you should be aware of is bleeding between your periods, okay? Now, this could be due to many reasons, that not necessarily because of cancer, particularly if certain women are on hormone treatments or people that are taking the contraceptive pill. Initially, when you start, you might notice some spotting here and there, and your doctor may have even warned you about that already before they prescribed it for you. And this often will settle over a period of 3 months, if at most, to be about 6 months, okay? So you know the reason why you're having that bleeding. Sometimes having a bleeding between periods might be because of infection. Fungal infections can cause that. Other types of infection can cause that. Certain sexually transmitted infections might present as that. So this might be non-serious things. However, they still need to be treated. So often it is important for you to see your doctor to get it checked, okay? So don't forget. Also, if you're having any abnormal discharge, so commonly women may discharge from the vagina because of yeast infection, which we call thrush, and this might present as, you know, thick white discharge or even creamy discharge. You might find that it's itchy or burning or feels sore down below. You know, you might treat yourself even over the counter by going to get the medicines to treat it. If it's not settling, then you need to see your doctor to examine you to make sure that it's nothing else to worry about, okay? So that's something for women to be particularly aware of when it comes to bleeding or discharge. The next symptom is weight loss, okay? So we're talking about unintentional weight loss. Most of us are on a diet, or we're trying to lose weight, and therefore we might lose weight because of that reason, okay? Some people, due to excessive stress, can also lose weight. Some people, when they're depressed because they're not eating, they're not looking after themselves, can lose weight. So these are all non-cancerous reasons where you might lose weight. But if you unintentionally lose weight, so not because you're dieting and you can't really explain why you're losing weight so significantly, so drastically, okay, then it is always important that you see your doctor. A lot of cancers can present as that, all right, and it's just the way that cancer cells do operate. So it's important that you see your doctor. Also, the other thing that may go hand in hand with weight loss is the loss of appetite. So, and someone might say, oh, because actually I've not been eating a lot, so it might explain why I am losing weight, okay? But actually, loss of appetite could also be a symptom of cancer. So if you're losing weight, unexpectedly, or you find that you just lost your appetite, you don't enjoy food, you're not eating, you don't feel like eating, and it's not because you're feeling depressed, and you just can't explain, not because your mouth is sore, so you're not eating, then you need to go and see a doctor, okay? So with cancer symptoms, it's always about, the key word is the persistency of the symptoms. So if your symptoms are persistent and you can't explain the reason why, then it's always important to go and get it checked. Another reason why people might lose weight is actually infections. Infections like TB may present as weight loss. Often TB infection might present with weight loss, with night sweats, with fevers. So the three symptoms can be together. And actually, if that has presented acutely or even over a period of weeks, because TB infection can sort of lay dormant for a long time in the body until you get an active infection. So if you notice symptoms that is just going over periods of weeks or months, and you think you may have been exposed to TB, or you've come from a country where there's a high epidemic of TB, then it's really important that you get yourself checked, obviously, because TB is a serious infection and that you will need that right treatment for it, okay? So moving on to the next one. The next symptom is persistent bloating. This is when you sort of feel full all the time. Some people feel like, I feel pregnant, okay? Now, as you can imagine again, feeling bloated is such a non-specific symptom. And I think, every woman or even men have gone through bloating, at some point in their life. So if you're feeling bloating that is not relieving, and this may also present as, always feeling full quite quickly. So when you're eating, you can't eat much. You just feel full all of a sudden, okay? It might feel like bloating, that sort of starts off, and then throughout the whole day, you just feel bloated, okay? You might feel like pregnant. That's how some people describe it. And you can't really pinpoint why you're feeling that, This could be a symptom of ovarian cancer. Now, just to say that ovarian cancer is one of the cancers that often, we don't pick up early at all. But because, as you can imagine, bloating could be due to a lot of reasons. So often people would just sort of ignore it or say, oh, it's due to this, it's due to that. And so they don't go and see a doctor about it. And often we miss it. So ovarian cancer is one of the cancers that often, by the time we pick up, is very advanced, okay? And then obviously if something is advanced, the chances of cure is less likely. So it's really important that you get it checked, okay? The next symptom is continuous itching in the back passage or in the genital area, all right? So commonly due to fungal infections, we can feel itching in the back passage. Also worms can present as itching in the back passage. Even sometimes when people have piles, they can present as itching in the back passage. So these are sort of symptoms that you wouldn't take seriously. Also, if people have rashes, like things like eczema, which is a chronic sort of dry skin condition in the groin or in the back passage, it might present as that. So fungal infection, like I said, so it could be due to, it's still one of the non-specific symptoms as well. But the key word, once again, is the persistency and the fact that you cannot explain it. And you've tried treatment over and over again and it's not helping. Then you need to see your doctor, okay? So the next symptom that we are talking about is non-healing ulcers. Naturally, when you and I, we injure ourselves, our body is capable of sorting itself out. Within a matter of hours, within a matter of days, we see the healing process take place and the skin closes up and we are back to normal. However, if you have a wound or any form of sore that is not healing properly, okay? So I'm talking about 3 weeks, 4 weeks down the line, this wound is still looking very fresh. then it could be cancerous, okay? There could be other benign reasons why, all right? Poor circulation could be a reason why, and this may be very common in diabetic patients where they get diabetic ulcers. This might be the reason why it's not healing, because of the poor flow of blood to the area, because you need adequate blood supply for a wound to be able to heal, okay? So if this is not in place, then that could be a reason why a wound is not healing properly. Also, you might notice mouth ulcers, which may present as like white patches on the gums or on the sort of soft areas of your mouth, inside your mouth. So if that also is not healing, then you need to get it seen. But there could be other reasons, like when the body is run down, when there is an infection, some infections like HIV infections, where it suppresses the immune system, that could cause ulcers not to heal properly. So those could be the other reasons. But obviously, if you don't see your doctor about it, then we won't be able to know and do the necessary test that needs to be done, okay, to see whether there's something we need to worry about or not. Now, moving on swiftly, and this is the last one for today, is headaches. Now, I know a lot of people actually do worry when they have a headache, and the first thing actually most people think about is that, do I have a brain tumor? Thankfully, okay, most headaches are not due to you having a brain tumor. Yeah? There could be so many, 110 reasons why people might have headaches. Simple things like even not hydrating yourself well can present as headaches. Sometimes when you have a viral infection, part of it could be feeling headachy. That could happen. If you have a tension headache, due to ongoing stress, or sometimes we don't even know the cause of why it happens, people can have a headache. Migraines could also be a reason why people have headaches, okay? There could be many reasons. Sometimes there could be serious things like a bleed in the head can present as a headache, okay? But when it comes to headaches that may be related or maybe due to a tumor growing in the brain, the kind of headache that you should be aware of is the constant headache. Most people will say this headache is there all the time, so you're not getting any relief from this headache, okay? And it doesn't have to be 10 out of 10. It doesn't have to be the most severe headache. Often this kind of headache will be something you will say is like mild to moderate in terms of severity, okay? So it's like nothing, not much at all in terms of pain to like midpoint of pain, all right? But it's there constantly. So often people that have this type of headache would still manage to carry on with their day-to-day activity, all right? But probably what will make them want to come and see a doctor is that the headache is not going away. But it's not like their typical migraine where it might be left-sided or right-sided, one-sided most of the time. They might feel a bit of blurring of the vision. They might feel nausea. They might feel vomiting. They might feel like you just want to lie down in the dark. They sort of know the trigger for it. They will say, no, it's not like my normal migraine. This headache is a bit different, okay? So constant, okay, is there all the time or most of the day. Yeah, when you take paracetamol or ibuprofen or some painkiller, it doesn't really do much to it. Yeah, but you remember a tumor is there, it's not going away, so that's why you're not getting that relief, yeah, of pain by taking painkillers. So that's one of the features. The other feature that you might notice is vomiting, but vomiting mainly in the mornings, okay? So you might notice that this person is having this headache that is constant and also vomiting in the mornings, okay? So this is a red flag for brain tumor when it comes to headache. Also, the headache may wake them up, okay? So it wakes you up, okay? At night, it wakes you up. So that's something for you to be aware of. However, if you have any sort of headache that is not going away, you're taking medicine, it relieves a bit, it's still not settling, or you're vomiting with it, or you notice changes of your vision. Either you lose a vision or you feel blurring of vision, you have a very severe headache with a fever or with a rash. These are all, even though they are not cancer type of headache, but they may also mean something serious that needs to be treated, okay? If you have the most severe form of headache ever, you still need to see someone, because that might be a bleed in the head, and that's something that you don't want to avoid, you don't want to miss. Okay, so it's important that you still get seen anyway. All right, now alongside having this headache, you might find out that you have other symptoms. So feeling of tiredness, you're feeling weight loss, you may have a poor appetite, a change in behavior. Remember, your brain, your nerves, okay, when it comes to our behavior, our mood, the brain plays an important part of it. So depending on the effect of the tumor on the brain, the functions of the brain may be affected, and one of the ways that someone may present is a change in behavior. Yeah, all of a sudden very aggressive, all of a sudden mood changes. Okay, they become very irritable all of a sudden. So that could also be due to other reasons. Yeah, because a lot of people going through the menopause have some of these symptoms, by the way. But when it comes to brain tumor, this is something that can happen as well. So I hope tonight's session has been useful for you. So really, that's the end of the cancer red flags. But I think the key word here is actually two words: persistent, okay, and unexplained. Okay, so if you have any symptom of any sort, okay, that is not going away, you cannot explain, you've even sort of tried and tick the boxes and self-treated yourself, but it's not going away, whether you've even seen a doctor and doctor has thought, oh, it might be due to this, so let's treat it, and it's still not gone away, please do go and see a doctor. It might be that you might need to go and see another doctor to look at you with fresh eyes, okay, to see whether there's something that we are missing. So if you have any symptoms that is not going away, please do get it checked. Okay, your health is very important. And like you've sort of noticed in these 2 sessions that we've done with red flags of cancer, there's no specific symptom when it comes to cancer. There's a multiple of symptoms, and that's because there's various types of cancer. Okay, so the presentation might be very different, but also the danger is some of these symptoms are so non-specific, and it could be due to many other reasons, and hence it is still very important that you take the necessary precautions. Yeah, make sure that you avoid and prevent yourself from risk exposure as much as possible. There's a lot of videos that has dealt with a lot of health, different aspects of health on this page and on the channel, so please do take time to have a look at them. Health is wealth, and it's really important that you invest in your health. So do all you can do, at best, to look after yourself, and the rest will just fall into place. All right, so thank you so much for tuning in, and I hope that you gained a lot. So I'll see you next time. Bye bye.